We've talked about it, but we've never done it. And we look forward to really meeting with those individuals that are newer to our organization or brand new to our organization so that we can help them connect them with you. Because I know that same privilege was extended out to me when I joined years ago, and still cherish those relationships and mentorship relationships that I have formed over the years with my colleagues throughout ALSN. All right, so let me introduce Kevin. So Kevin, and the title of his presentation is Role Modeling Resilience, Refueling Your Passion for the Journey Ahead. Mr. Kevin Sowers is the president of Johns Hopkins Health System and the executive vice president of the Johns Hopkins Medicine. As the second person in Johns Hopkins history to hold these dual roles, Mr. Sowers oversees the health system's 6 hospitals, which includes the Johns Hopkins Hospital, Johns Hopkins Bayview Medical Center, Howard County General Hospital, Suburban Hospital, Sibley Memorial Hospital, and the Johns Hopkins All Children's Hospital. And he also sets the strategies that advance the mission of the organization to deliver outstanding care, change, and to train the next generation of leaders in advanced research and discovery. He also serves as the chair of the Johns Hopkins Community Physicians, which has more than 40 primary specialty outpatient sites throughout Maryland and the DC area. After 32 years at Duke University, serving as the health system CEO there, Mr. Sowers came to Johns Hopkins. He earned his bachelor's degree in nursing from Capital University and a master's of science in nursing from Duke University. He is also a fellow in the Academy, and he has the Academy of Nursing. He's collaborated on numerous research efforts as well as consulted internationally. He's published extensively, and he speaks on broad issues such as leadership, organizational change, mentorship, and cancer care. So please help me in welcoming Kevin Sowers as our first keynote speaker. And everyone, once again, thank you so much for being with us today, and we look forward to being with you throughout the conference.
Good afternoon. My name is Kevin Sowers, and I'm president of Johns Hopkins Health System and executive vice president of Johns Hopkins Medicine. And today I'm going to talk to you about role modeling resilience and share how to refuel your passion for the journey ahead. But first of all, I want to invite you to go with me. You know, Into the Woods is a musical by James Lapine. Perhaps you've heard the story. It's a composite retelling of several fairy tales, but it's from an adult's perspective. In the story, the characters who have always thought of as good, Prince Charming, Little Red Riding Hood, Jack from Jack and the Beanstalk, they're all called out on their mistakes and less than ideal behaviors. Since the beginning of time, the story says the world has made heroes out to be perfect human beings. But even fairy tales are more complex than that. At the end of Into the Woods, the characters all come together and really grapple with the fact that while they have traditionally been seen as good, they are, in fact, not perfect. So it becomes a story about forgiveness of others and about self-forgiveness. I share this story that when we're beginning our careers, we want to live the fairy tale. We want to make a difference, save those who are in distress. But over time, we can lose our excitement and grow weary along the journey. For the last 20 months, our world has faced many challenges, including a global pandemic, political division, ethnic, racial, and social injustices, and fallout from the economic realities tied to navigating all of these issues simultaneously. And dare I say, these combined challenges have tested even the most seasoned among us, leading to something that I think can best be described as disenchantment. More so now than ever, our ability to achieve success is dependent on our ability to remain resilient and learn to find the wonder again after the luster and excitement have begun to fade. And we need to be sure that we are taking care of ourselves and each other so that we can continue to be there for the people who need us. So today, I'm going to share 7 tips to support effective leadership while refueling your passion for the journey ahead. And to provide you with some context for my own journey, I'll tell you a little bit about my background. I began my healthcare career as an oncology nurse at Duke University Hospital in Durham, North Carolina. At that time, my goal was simply to use my life in service to patients and make a difference in the lives of their families as they navigated difficult moments in their lives. And I had my very first dose of reality on my very first day as a nurse. I was a new grad, fresh out of nursing school, when I walked into the report room at Duke University Hospital. A nurse turned in her chair, looked at me up and down, and said to me, "They didn't tell us anything about a man coming." I got to be honest with you, as a new grad, I wasn't quite sure what to do, so I looked at the assignment sheet to see who was going to be precepting me. And it turned out that that nurse was going to be my preceptor. Her name was Tanya Gray. As I walked down the hall with Tanya, she said, "I'll let you know in the next 6 months whether or not you can stay." You know, in those 6 months, Tanya was hard on me. But the lessons I learned from her still resonate with me today. I learned a lot about Tanya, and I learned a lot from Tanya, including the power of one nurse to impact the lives of others. And 6 months after I first met her, it was Christmas time. She brought me a present. There was a card on top of that present that read, "I guess you can stay." And so I stayed. And that was my very first lesson in reconciling my expectations for how I thought things should be versus how they actually were. I also learned that all difficult people aren't always barriers. Through the years, I believe we need to learn to garner the ability to discern who around us is challenging us to become better in our own lives and who is trying to prevent us from fulfilling our purpose. After completing my master's degree, I advanced to the role of oncology clinical nurse specialist, and I found my rhythm in caring for adult cancer patients. At that time, I actually thought that the duration of my career would be at the bedside. Now, this is when the next dose of reality would actually also be my pathway into leadership. And it all began one day when I was called into the office of Brenda Nevijan. Brenda was the director of oncology nursing for Duke University Hospital. Today, Brenda is the CEO of the Oncology Nursing Society, and she remains one of the greatest mentors I've had the pleasure of learning from in my career. But I have to tell you, at the time, she was quite an imposing figure to me. You see, this was the 90s. The Balanced Budget Act had just been passed. Academic medical centers took large cuts in graduate medical education. Managed care was trying to drive capitated plans into the marketplace. And at Duke Hospital, there was a new unit that was going to be driven by nursing protocols and pathways. And the provider coverage model was going to use NPs and PAs. Now, today, that is the norm. But in the 90s, this was a new and evolving model. And I'll have to admit that when she called me into her office all those years ago, I was a little afraid. To provide some background, there was a nursing shortage at the time. And as I said, Brenda was serving as the director of oncology nursing at Duke Hospital. And Duke Hospital was 30 days away from opening this new 30-bed unit. And Brenda said to me, I need you to serve as the nurse manager for this new unit. The nurse manager had given 30 days notice. So she told me I had to go downstairs and create a punch list for construction. I had to write all the policies and procedures. I had to train all of the nurses on chemo and IV infusion. My response was, Ms. Nevajon, thank you for your confidence, but no thank you. I'm really happy being a clinical nurse specialist, and I'm sure you can find someone else. That's when Brenda looked at me right in the eyes and said, I'm telling you that I need you to serve as a nurse manager. And if you're telling me no, then I'm telling you that you're insubordinate. I'm pretty sure that my jaw dropped. I wasn't trying to be insubordinate, but I didn't feel ready to take on a leadership role. Surely there had to be someone else who was better prepared than me to lead. That was when Brenda taught me the very first of many lessons in leadership. And it's one that has served me very well in my career. She said to me, Kevin, in the life of an organization, sometimes the organization will need you to do something you may not want to do, but if you're telling me no, then you're being insubordinate. I said, Miss Nevajon, I'll get right downstairs and get started. And that is how I began my career in healthcare leadership. From there, my leadership responsibilities evolved. I was a unit manager, an associate operating officer, a senior operating officer, the chief operating officer. But I began my career at a large academic medical center. And it was then I began to appreciate the intersections of our tripartite mission focused on patient care, research, and education. And these experiences really began to shape my understanding of the benefits and challenges of working in a large, complex healthcare organization. In 2009, I became president of Duke University Hospital, and then in 2018, I was named into my current role as the president of Johns Hopkins Health System and as executive vice president of Johns Hopkins Medicine. I'm only the second person in the organization's history to hold these dual roles. And my role today is important to the success of Johns Hopkins Medicine because it unites our health system and our School of Medicine, allowing us to operate as one, again with full appreciation of the linkages between patient care, research, and education. As president of the health system, I'm responsible for a 6-hospital system. 4 of our hospitals are located in Maryland. 1 is located in our nation's capital, Washington, D.C., and we have a standalone children's hospital that's located in St. Petersburg, Florida. Our home care services are available throughout Maryland and Washington, D.C., and in some parts of Northern Virginia and Southeast Pennsylvania. I also serve as the chair of Johns Hopkins Community Physicians, which has more than 40 primary and specialty care outpatient sites throughout Maryland and the Washington, D.C. area. In my role as vice president of Johns Hopkins Medicine, I serve in a leadership capacity for the School of Medicine, which is part of Johns Hopkins University. So in totality, Johns Hopkins Medicine is a $9 billion academic medical enterprise and health system with a global reach. We well know that since the start of the current global pandemic, healthcare organizations around the world have been challenged to partner across academic and governmental agencies and public and private businesses to develop well-coordinated responses to the COVID-19 pandemic. Which brings me to the first key to successful leadership. Leaders must develop the ability to cultivate peace and calm while standing in the unknown and not get caught in the chaos. When we look at the evolution of healthcare, We have experienced a series of major changes over the last 10 years. Changes that impact the way we deliver care. Changes that have provided greater transparency around hospital performance on the quality indicators. We've had major changes to how our organizations get reimbursed. And all of these changes have forced healthcare leaders to recreate their models for running sustainable healthcare organization. As leaders, we need to understand that change, particularly transformational change, takes time. And the current global, political, and economic environments have created a lot of uncertainty for all of us. But no matter if you're a leader developing responses to COVID-19 or leading transformational changes within your organization, you need to learn to be calm amidst the chaos. And I am very thankful to have learned that lesson early on in my career. So for just a minute, let's go back to my first year at Duke Hospital. When I was a new grad, only 6 months out of nursing school, I became the charge nurse on evenings and nights. Now, I don't recommend that as the norm, but the unit leadership had to do it. It was during the great nursing shortage across the United States back then, and they didn't have enough experienced nurses to take the charge role. And I was in charge on one of those evenings that if anything could go bad, it happened. I had a code on team 1, and halfway through that code, they called a code on team 2, and I was running back and forth from one side to the other. As the evening started to calm down, there was a patient's husband who had been in the hallway watching me run back and forth throughout the unit. His name was Dean Bolton, and he was the dean of students at the University of North Carolina at Chapel Hill. He stopped me and said, "Kevin, I need to teach you a valuable lesson in leadership. Crazy people will make you feel crazy only if you let them. Once you become a part of the chaos, you become a part of the problem." You see, leaders rise above the chaos so that they can separate the facts from the emotions and lead people to the other side. You know, his words still ring true for me today. When you start contributing to the chaos or get caught up in it, that is when you lose your effectiveness as a leader. And meeting the challenges of today's complex healthcare environment requires having leaders who are at the helm, who can bring order and direction in the midst of chaos. This brings me to my second key to successful leadership: the ability to collaborate effectively with other leaders across industries. This is something that author Walter Isaacson, who wrote the book The Innovators, calls creative collaboration. An example of this is the public-private partnership that I jointly led with other leaders in the state of Maryland. Successfully addressing the needs of our community during the current pandemic requires working together in new ways. The Baltimore area COVID-19 Public-Private Task Force, co-developed by Johns Hopkins Medicine and the University of Maryland Medical System, facilitates communication between the two academic health systems, private businesses, Baltimore City, and Maryland state leadership, and supports data-driven decision-making across the board. As a member of the task force and the leadership team, I work alongside the CEO from Care First, which is our Blue Cross Blue Shield payer, and one of Maryland's largest payers, and the University of Maryland Medical System President Dr. Mohan Santha. And together we strategize and use our combined resources in a unified way in response to the pandemic. You see, this is very different from the past because University of Maryland Medical System is one of our regional competitors. But because of the need to develop a regional response to the COVID-19 pandemic, we made the conscious decision to work as partners to protect the health and safety of the people living in our region and beyond. with members who represent all organizations of the Private-Public Partnership Task Force, we focus on data sharing, call center interconnectivity, communications, and developing strategies to test, care for, and vaccinate vulnerable populations. These vulnerable populations include people experiencing homelessness, people who live in long-term care facilities, those who are incarcerated in jails, prisons, and detention centers, and also the population living in senior housing centers. Our call centers allow us to manage the flow of COVID patients throughout the region so as not to inundate any one facility. We also partner with the University of Maryland Medical Center to convert the Baltimore Convention Center into a field hospital. We co-manage the 250-bed facility, which we also built to help manage the flow of COVID patients throughout the state. We've also used the facility as a COVID testing site, as a site for mass vaccination, and to house an infusion center that administers FDA-authorized monoclonal antibody therapies. Our ability to share data and resources have been a key part of our success. Early on during the pandemic, based on data that showed that a large number of residents in the surrounding zip code tested positive for COVID-19, the task force opened a drive-through testing site at a facility in that area. Based on the additional data showing COVID-19 is disproportionately affecting members of the African American community, the team developed and distributed educational flyers about COVID-19 in targeted communities, and Johns Hopkins Medicine provided funding to support an educational campaign. This actually brings me to my third point. The third key to successful leadership is the ability to make data-based decisions, using data to drive strategic decision-making. Increasingly, we are being asked to provide better quality at a lower cost and in a more efficient manner. In today's world, this is called value-based care. And we must train a new generation of providers to operate in an environment that is ever changing, shifting, and evolving. And one of the things that we've learned is that as we grow and expand our organizational footprint and become increasingly more complex, we need to ensure that we have the right structure and processes in place to ensure that the level of care expected as a part of Johns Hopkins is reflected at all sites. You know, this doesn't happen by chance. We have to mindfully set up the right governance, the right administrative structure, and processes for this to happen. And effectively managing across an enterprise requires the ability to effectively collect and manage data from across the enterprise. And because of how we manage data across our organization and across the areas in which we operate, I can tell you the story of how we're managing COVID and the pandemic response right now. For instance, among adults hospitalized right now with COVID, 99% that we're seeing in our hospitals are unvaccinated. We've also seen an increase in the number of children diagnosed with the Delta variant of COVID. And we are watching the data to see the impact of schools reopening on the number of pediatric cases. We've seen a rise in the peds cases and hospitalizations due to COVID, particularly after the last several months at our children's hospitals. I can tell you that throughout our health system, since the pandemic start, we have diagnosed more than 26,064 patients with COVID. This number represents the total number of COVID-positive tests we've actually diagnosed in our labs at all of our locations across Johns Hopkins Medicine. In our health system hospitals, our staff have now cared for more than 40,000 COVID patients. One of our physicians, Dr. Brian Garibaldi, also leads the Johns Hopkins Precision Medicine Center of Excellence for COVID-19. The goal of the center is to allow us to use big data sets to support an understanding of the factors that underlie the pathobiology of COVID-19, the progression to severe illness or death, and the effectiveness of therapeutic interventions in order to provide personalized care to patients infected with SARS-CoV-2. We want to improve the care of patients infected with SARS-CoV-2 by learning about COVID-19 pathobiology, likelihood of disease progression, and the impact of specific therapeutic interventions. We aim to provide this information to frontline clinicians, patients, and family members at the point of care. We have also become increasingly mindful about how we share information across organizations to ensure that we are not only collecting meaningful data, but also able to share it in formats that protect patient privacy while supporting effective decision-making at the local, state, national, and global levels. We've seen the benefit of this capability with the COVID-19 dashboard that was created by Johns Hopkins School of Engineering and collaborated with Johns Hopkins Medicine. And it has become a global resource for the COVID-19 pandemic-related data. You know, when we step back for a moment and consider how extraordinary it is that we now have the ability to see global data that tells the story of the current COVID-19 pandemic, we must consider this, that what we've seen over the last 20 months is indicative of the challenges and benefits of operating within a global society and complex environment. And addressing modern day challenges is going to require us to continue to break down barriers and continue to focus on ways we can be more inclusive and more innovative in our global community, which is the fourth key to successful leadership, a focus on innovation. There's a story about Alexander the Great, and it goes like this. Alexander the Great had just began his career. Since he hadn't yet proven himself to be a great leader, we're going to assume that he was just Alexander the Okay. You know, Alexander, as a young man, wanted to do something that would prove not only to others, but also to himself that he was capable of and destined for great things. So he decided he would solve the problem of the Gordian knot. The Gordian knot is described as an ancient rope tied into a series of knots at the front of a cart that belonged to Gordius, who was the father of King Midas. The cart sat in front of an ancient city called Phrygia, and the people of Phrygia believed that whomever untied the knot would one day rule all of Asia. Time and time again, people had tried to solve the puzzle and untie the Gordian knot. But time and time again, they all failed. Alexander knew that solving the unsolvable would make him a person of great renown. So he tried, and he failed. And he tried again, and again. And just like everyone who had tried before him, he failed repeatedly to untie the knot. So Alexander decided to do something that had never been done before. He decided to break convention. He drew out his sword, and with one swift blow, he sliced through that Gordian knot, causing it to tumble onto the ground. You see, Alexander realized that there is more than one way to solve a complex problem. And while we don't remember the names of everyone who tried to solve the puzzle before him, we do remember that he alone was the one to solve the puzzle of the Gordian knot by approaching the problem differently than anyone else had in the past. This is the type of thinking that I like to encourage for teams. Much like Alexander the Great and the Gordian knot, Our organization has evolved out of this type of out-of-the-box thinking. And this is the type of thinking we're going to need to use to take us to the future. An example, at Johns Hopkins, we have already become very good at reporting upon and improving upon metrics that we're mandated to measure by the government and payers. We are now taking it to the next level of performance and building a system-wide quality performance measurement system that ensures that we have identified and met the highest standards for performance for high acuity programs by clinical specialty, down to the physician level. When it comes to improvement interventions, we will move beyond local level interventions and focus on smart system design, creating processes and structures designed from the start to be implemented for every site in our system. We also need to evolve our corporate system function, making it a more powerful resource for our sites that makes it easier for them to deliver the best care. For example, if the system can provide the sites with the data they need to improve, they can now focus on how to improve rather than trying to get the data. And we have to be transparent and collaborative. This includes openly sharing adverse events with each other so that we can learn and improve our services. And our desire is to further this type of innovative mindset, to continue to push us to the forefront as the healthcare leaders of the future. And leading innovation is going to require all of us to be flexible and resilient. As leaders, we need to learn to develop our own personal resilience. And this can be difficult in the midst of a global pandemic when you're managing several added layers of complexity. A recent study showed the impact of pandemic-related staffing changes on patient care. They found that in 2020, hospital-acquired infections rose significantly from the year prior. They particularly noted the rise in CLABSIs, CAUTIs, and VAEs. They also found an increase in surgical site infections, C. diff, and MRSA. This, with the fact that we're also experiencing a national workforce shortage of epic proportions, there are physicians and staff who are opting to take early retirement. The trends show that nurses who've been working for 1 to 5 years in your hospital are taking the option to travel and go after the additional pay. We've seen a segment of the workforce completely leave healthcare. I'm concerned that these trends are not just related to the pandemic. Our staff were struggling prior to the pandemic with issues of burnout. The pandemic has only escalated the issue. Current staffing in hospitals across this country is not sustainable. On the extra hours current staff are working to cover the needs of our patients, and the cost of travelers are not sustainable. I believe we will have to redesign how we deliver care with a different provider mix, with every staff member functioning at the top of their license. As leaders, it seems that the challenges just keep coming. And if you're not careful, reality can cause you to become jaded. And you not only gradually chip away at your own positive view of the world, but you can also negatively impact the idealism of those coming behind you. We have to consciously adjust our thinking so that we are acknowledging that while there is no such thing as perfection, we don't move into becoming jaded about the world and about our place in it. The truth is that there are times in everyone's career when they might feel themselves stumbling a bit, finding it difficult to get their footing. I'd like to share something with you I learned from a colleague who served as a women's basketball coach for many years. She's not only a great basketball coach, she's a great motivational speaker. And this is what she would say to the athletes that she coached. She would say, There will be times during the game when you will lose your footing, no matter how exceptional of an athlete you are. At some point, you're going to fall, and I want you to be prepared. And so she would teach her players what to do when they felt themselves going down so that they could prevent themselves from being injured. And I say that because at some point, all people struggle. But it is up to us, up to each of us, to learn to recognize when we need additional support and resources so that we can get the help we need. There's no shame in losing your footing, but throughout our lives, we should all seek to learn to fall well and be resilient. I also want to touch on the value of adversity in our lives, because sometimes I think we tend to talk about getting through difficulties or overcoming them without stopping to acknowledge the value of adversity to push us to reach our greatest potential. Amanda Ripley is the author of a book called The Smartest Kids in the World and How They Got That Way. And she said, and I quote, "Resilience is a precious skill. People who have it tend to also have three underlying advantages. Number one, a belief that they can influence life events. Number two, a tendency to find meaningful purpose in life's turmoil. And three, a conviction that they can learn from both positive and negative experience." This ability is key to something that MacArthur Genius Grant winner Angela Duckworth has identified as imperative to achieving our full potential. Duckworth is a researcher, and you may have heard of her New York Times bestseller titled Grit. The book highlights her research about people who achieve the highest heights in their given fields. And what she found is that talent and skill are not sole predictors of long-term success and achievement. The secret, she writes, is grit, defined as the combination of passion and perseverance that makes high achievers special. Duckworth tells the story of diving into data around West Point graduates and, along with her colleagues, trying to figure out what qualities or factors would predict who would stay through the intense combination of training and academics and who would quit. And what they found was the individuals who went on to graduate weren't necessarily the most athletic, although they did have a greater than average level of athleticism. They weren't the most intelligent, although, of course, they had demonstrated prior academic success before gaining admission to the school. What Duckworth and her colleagues discovered was the biggest indicator of their success was grit. And then when they looked across the different professions, they found that their findings were true across the board. Those who achieved the highest levels of success in their fields were the people who remained passionately focused on their purpose and kept going to achieve success despite any setbacks and potential roadblocks. What they also found was that some of the smartest and naturally gifted people did not succeed because when faced with failure, after only knowing success, they were devastated and gave up altogether. In short, they never learned to fall well. So we have to redefine what being successful means. It's important to our long-term health and well-being. It's important in order to build resilience, and it's important lessons for us as leaders and instructors to include these lessons in our teachings. We have to consciously help future generations of ambitious young people to avoid the increasingly pervasive traps and pitfalls of perfectionism, especially in this age of social media that makes the lives of others seem so much more picture perfect than one's own imperfect life. Because there is a danger in trying to build your life to mimic those of others when all we are seeing are carefully edited versions of reality. I also want to talk about supporting our teams, because another lesson that I've learned in my career is that as a leader, you need to protect your team's resilience and provide them with the resources and support they need to persevere through crises. And this is particularly the case when it is an extended crisis. Early on during the COVID-19 pandemic, I started having concerns about our staff's stress levels and the impact the pandemic was having on their personal and professional lives. It was challenging to even our most seasoned team members as businesses and schools closed. Parents and caregivers were having to figure out how to navigate homeschooling and childcare. Some had partners and spouses who lost their job when the businesses shut down. And during these early stages of the pandemic, there was a heightened sense of fear. People were afraid of the possibility of taking COVID home and making their loved ones sick. And remember, at that time, very little was known about transmission modes. I also witnessed the moral distress of providers caring for patients dying from COVID without their loved ones at the bedside. And it reminded me of the same types of emotion we experienced as nurses in the 80s at the start of the AIDS epidemic. So I knew that we needed to support our team, and so this became a standing topic of discussion at our regular leadership roundtables. We tapped into our internal experts and developed interventions to help our employees navigate the many challenges they were facing. Our Office of Wellbeing developed a one-stop website where staff could find help for everything from sleeplessness to depression to support for child and elder care. We held virtual town meetings where we partnered with our infectious disease experts to share what we knew about COVID and how staff could protect themselves and their loved ones from getting sick. We also started a fund based on a gift from a grateful donor. It allowed us to provide financial support to ensure our most vulnerable employees had food for their families, also had laptops for their children so that they could learn from home. It also covered other hardships like rent and household bills. We also partnered to create food pantries at each entity for our employees, and one of our leaders was granted funding so that we could actually feed the most vulnerable families in our communities. As issues of social justice came into the forefront of our nation and our world, we developed additional resources to support our physicians and staff of color. We provided manager training to support facilitation of effective discussions about social justice. We also held town meetings in which we had candid conversations in concert with our staff. We also spoke openly how we could create real, lasting change together. It's important that our teams see us and hear from us and know that we actually care. The reason people stay in your organization is because of the relationship with their local manager, but they also leave because of the relationship with their local manager. I just ask you, what are you doing to support and develop your local manager? Because that's important. It's so important. I can tell you that you can learn more about how your staff are doing from donning PPE and visiting them on COVID and non-COVID units than you can ever do from behind a desk. So I've talked about the need to cultivate peace while standing in the unknown. I've highlighted the importance of collaborating with other leaders and the need to make data-based decisions. I've illustrated the need to be innovative and to build personal and team resilience. My seventh and final key to successful leadership in the new healthcare environment is ensuring that you're connecting back to your true purpose, always. As healthcare leaders, we are tasked with looking ahead into the future, to use data to predict how our communities will grow and how we will need to evolve our care delivery models along with that growth. This includes maximizing the use of our resources to deliver high-quality care and services that are easily accessible as well as affordable. And the challenges of our current pandemic have also illustrated the significant value our organizations bring to our communities, our nations, and the world. But sometimes in the midst of the chaos, when the people we are trying to collaborate with do not want to cooperate, when we can't even get the data we need to drive our decision-making, and when our organizations struggle to be innovative because our teams have grown so used to the status quo, those are the moments when we have to remember that as healthcare leaders, our purpose is to overcome any obstacles to drive our mission forward and achieve our vision. You see, the work we do each and every day not only impacts the current patients we serve, it also will impact our communities, our nations, and our world for generations to come. And the one way to ensure that we continue to connect to our purpose is to never lose sight of the human element of the work we do. I'd like to share a story that I read in the Smithsonian Magazine. It's fascinating how science and technology have evolved to paint a clear picture of how the human body has changed over thousands of years. The article was about how scientists long assumed that due to the extraordinary size of early humans, particularly the size of their hands, that they were clumsy and recklessly forceful. But new technologies have allowed British researchers to study the hands of early humans in depth and to get a better understanding of how they actually worked, to see their muscle patterns. And these scientists were able to get a better picture of how early humans actually used their hands to grip objects and to wield tools. And what they found was that early humans' hands operated with more precision than previously thought. Actually, much more like modern humans, in fact. And these scientists realized that this actually made sense because in the context of the lives of the people who lived in small communities so many years ago, some were hunters and some were gatherers, but we also know that some were jewelry craftsmen, which required delicate handwork, and others created beautiful cave paintings that have lasted thousands of years to this day. You see, these new technologies have changed our narrative, not because the story is actually any different, but because modern technology has allowed us to have a better understanding of a group of our ancestors whose lives were much more complex than we ever previously imagined. Now consider the work we do today in the context of human history. Our methods are more advanced and evidence-based more than ever. Telehealth has introduced a whole new dimension into this picture. New analytics aid us in making decisions based upon precision medicine. We have been collecting social determinants of health to better understand the role they play in outcomes of the patients we care for. We have witnessed the start of the greatest public health emergency in modern times, development and improvement of effective vaccines, and mass vaccination, all in less than 2 years' time. And we have more information today to aid us in making decisions than we ever have previously in human history. But I want to remind you, data alone is meaningless without someone to connect it back to a person. To build relationships in which people feel comfortable sharing details about their lives that can help us make better decisions about their care. To use their data along with all of the evidence-based practice that guide them in making the best decisions related to health, wellness, and quality of life, including decisions about getting a vaccine that could help save their lives and protect their loved ones. To understand that data is not the entire story because people and the systems in which they live are much more complex than that. And we should also have a better appreciation for this more today than ever before in human history. The relationships that we build with patients matter. The relationships we build with our physicians and staff matter. Our regional, state, and global partnerships matter. We actually know that the relationships we even build through events such as this one matter. From the time of early humans, when survival meant having strong relationships as sources of protection and access to resources until now, strong relationships helped hold our societies together. And our work is part of the fabric that helps our communities and our world function properly. Many years from now, when we reflect back on this time, many will question how we got through it. The global pandemic, its impact on healthcare workers, schools and business closing, political unrest and division, mass vaccinations, widespread recruitment and retention challenges. But the playbook that we create today to help us navigate this pandemic will support the next generation, to help them respond to the next series of challenges. If there is a secret to refueling our passion, it lies in reconnecting to our purpose, reconnecting to the people around us, and remembering that the work that we do has meaning and that this crazy, chaotic world needs leaders to help make sense of it all and to lead us out of the woods safely to the other side. No one among us is perfect. So maybe ours, too, is a story about forgiveness of others and about our self-forgiveness. Because although at times we might feel disenchanted, we are joined by an ideal that connects all of us and is greater than any one of us. And we also have to remember that our staff are watching every move we make and how we handle challenges. So to close today, I'd like to leave you with the words from a song that is in the musical Into the Woods. It's called Children Will Listen. And the words go like this: careful the things you say, because children will listen. Careful the things you do, because children will see and learn. Children may not obey, but children will listen. Children will look to you for which way to turn, to learn what to be. Thank you all for allowing me to be with you today.
Thank you so much for listening to Kevin's amazing